Mid-Iowa Health Foundation is interested in identifying unmet healthcare needs in our community. We support finding solutions to gaps, particularly in the area of access to care. This area of providing support and increased information and knowledge around the needs to have direct care workers who are available and trained and ready to address the needs of a growing, aging population and a population that has disabilities is extremely important. It's in our interest in helping others understand the complexity of the need to make sure that these individuals who are key to the healthcare team are supported and encouraged to be retained in their jobs and to be available.
Direct care workers are critical to the quality of care and life of Iowans and Iowa's economy. They are certified nurse aides, home care aides, direct service, and hospice workers. They provide care and support to Iowans of all ages and in all settings, from assisted living, in-home settings, nursing homes, hospitals, and hospices. How we view and value this workforce is a test to the moral fiber of our society.
The fact that there are 10 million folks right now who need care in this country, and that's going to double in the matter of 10 years.
And of course, Iowa has a smaller workforce, but a greater need for direct care workers.
I've had a grandson, now 7, who's Down syndrome, and he's going to need care, and he opened my eyes.
If you can keep seniors in their own homes or in an assisted living program or in a senior apartments, that to me is an optimum situation, and that's what the direct care worker provide for my mother. Without that, I don't think she would have been able to stay in her apartment. She would have probably landed in or ended in a nursing home.
A lot of things they do I really couldn't do because I don't know how to.
Because I did depend on her for so many little things. And Mother depended on her for so many little things.
The relationship between the direct care worker and our loved ones is so undervalued.
The big turnover rate and also just the attrition of direct care workers is a huge challenge for us from a public health standpoint and also from a patient safety standpoint.
And what I usually say is out of some movie a time ago, the tagline was, "Who are you going to call?" Well, when you hit the call button, very often it's the direct care worker that's going to be the first to respond.
I've been doing this for going on 30 years. I don't do it for the money. I do it because I care about who I take care of.
There are unsung heroes in the medical field that don't get the recognition they deserve. Without them, I wouldn't probably be where I'm at.
How do direct care workers assist Iowans?
The direct care worker in any type of setting is an important individual because that is your frontline staff. That is the person that is going to not only take care of that individual, but spend time every day with them. That's the person that the family is going to come to and talk to them as to how mom's doing, how dad's doing.
Direct care workers are the people closest to the patients. They are the people who take care of our parents and grandparents in the nursing homes. They are the people who take care of our parents and grandparents in their own homes when they can stay at home. They're the people that take care of the disabled.
Direct care workers, anyone who is working directly with patients. A number of different settings they could be working in. They could be working in a long-term care facility. They could be working in a nursing home, a hospital. We also have direct care workers that are providing services in the home. So anyone who's having contact with that patient, providing services to them.
Direct care workers have to be among the most important people for many, many of us. If you think about the vast variety of people they care for. For instance, often we think only that care workers and direct care workers work with the aging, but that's certainly not the truth. It's from the very young to the very old, all ages, all different sorts of circumstances. So they're very, very important.
They've got to have a great deal of commitment to continue doing some of the hard kinds of work that they do. The work can vary from, for instance, doing shopping for someone who needs it, giving bed baths, working with them in terms of their medications, providing a certain amount of, I'd say, moral support for them.
It meant a great deal. I don't even think you can put words as to what it meant to know that there was somebody there who actually wanted to be her friend, who took time for her, who would sit and, I mean, I know that one time she sat, Mother had a curio cabinet in her room, and they sat and talked about all the little things that were in her curio cabinet, where she got them, what they meant to her. To have somebody who takes an interest in them, gives them some self-esteem, some value. Because no matter how old we get, we still need to feel that we have some value.
As Iowa's older population increases, the traditional source of new direct care workers, women aged 25 to 44, is dwindling, leaving Iowa with a severe shortage of direct care workers. Adding to the shortage is the desire of persons with disabilities and older Iowans to remain in their own homes for as long as possible.
There have been a huge push to rebalance long-term care in the state and across the country. So those people who are elderly or disabled that want to stay in their home, that can stay in their home, can get access to services. And a lot of times those are direct care workers. And they are providing the services that allow those individuals to stay in their home.
There's been times where they call me and they can't fill the spot because they just don't have the people. And it's hard to hire people, I think, to do this job when they don't pay you enough for mileage, they don't pay you enough to work. And if they get sick, then my mom's going to fill the gap, or the person that was her day off has to come here. You're pretty much at their mercy if somebody can't come.
This is probably one of the most burning issues in terms of public health and community health. And to ensure then that these workers are, first of all, recognized, and secondly, paid, I would say, equivalent to the kinds of service that all of us will be needing as we age.
Direct care workers provide about 80 to 90% of the direct hands-on care to Iowans of all ages and in all care and support settings. Every day they touch the lives of thousands of Iowans and their families in the most personal and meaningful ways.
Direct care workers stay with the patient, our parents and our grandparents, all the time. That may be the only person that our parents and grandparents see on a regular basis.
It's harder to rely on family caregivers. I think everybody would like to do that if possible. You'd like to be able to take care of your father or your mother or your brother or sister if you could. But frankly, in this economy, it's not always possible to do that. Folks have to work, have to maintain. And so if you aren't able to get the kind of care from a caregiver in your community, if they aren't available, that puts a huge burden on your family.
Direct care workers are very important to people like Bruce Hamilton, who was only 34 years old when he fell from a ladder while putting Christmas lights on his house. The injury left him paralyzed and on a ventilator. This 15-year Army and National Guard veteran, former railroad conductor and avid snowmobiler, now relies on home care aides, friends, and family, including his teenage son, to help him with the normal routine things that many of us take for granted.
It's just the simple things. You think, well, I'd miss, going out, fishing, which I do, but it's just the small things the personal things that most people don't see you do, getting up in the morning and doing your own thing and getting ready for the day. But that's really what I do miss.
It means a lot because, I chose to stay here instead of go with my mom because I couldn't see leaving my dad how he is, and I just like helping around here too. I think it's really important. Well, I'm just really thankful that the nurses come and help out my dad. So it also helps out him, helps out my grandma and me. It just helps out everybody.
Because we have direct care workers, Rachel is able to live at home and have the freedom to be an individual. Our direct care workers have touched the lives of everyone in our family. Having a direct care worker makes us much better parents for our entire family. And the reality is, without direct care workers, Rachel would probably have to live in an institution. She wouldn't be able to live in her home. They literally make the impossible possible.
We were shopping one day, and she saw two women coming toward her. It happened to be one of the direct care workers that had worked with her. The direct care worker had her mother with her. And when they saw each other, they connected. I can't describe how suddenly this connection between the two of them occurred, but they both, without even thinking, hugged each other. And so you could tell that there was something far more than maybe doing the vacuuming or taking care of my mother, doing any of those kinds of things. There was a connection there that I couldn't have because I was working, but certainly that she sensed with this woman who had helped her. She was more than just somebody who came in. It was far more than that.
I stand here tonight as one of nearly 100,000 direct care workers in the state of Iowa. This is just not a chosen career for me. This is my calling. We care about Iowans. We are ready to step in whenever families need an outside assistance, and that's wherever we are needed.
I would treat them just like I would want my mom to be treated or my dad to be treated, you know, with dignity and respect, to sit there and listen to their stories, take time to, you know, make sure that their hair is brushed. And I've gotten into now where I'm painting fingernails. You know, they see me and, hey, are you going to paint my fingernails today and stuff? I don't ever wake up saying I don't want to go to work.
The doctors, the nurses, take care of the quality of health for residents. And by that I mean, you know, taking care of the medical issues. But the CNAs are there for their quality of life also. Taking that time to really address the person, who they are, who they've been, you know, what they like, what they don't like, allowing them to share their stories. That's really quality of life. But even if I called her every day, there were still times that she would be lonesome for somebody. And then, like Renee, would take that extra effort to say, it's very important to know that those who are taking care of her, you know, that they understand and the characteristics, the personality of that person.
All they want is somebody there to, you know, to talk to. Personally with Verlene, when she was sitting there in her room or she was laying there in bed, she would ask me, Renee, can you call one of my daughters? And I'm thinking, you know, okay, you know, their numbers were right there, and I would call them up and say, hey, Verlene needs to talk to you. And maybe it wasn't, I mean, she could have been fine, but she just wanted to hear their voice. And I took the time to do that. So I've gotten to know families.
My mother just passed in April. I think it's difficult for anybody to put their parent in a care facility. Even today, I still think, what could I have done to give my mom a better quality of life?
Direct care workforce issues are complex and urgent, and they must be addressed. Having health care insurance doesn't mean one has access to the care or support they need. Access to care simply isn't possible without a stable, well-educated, skilled, certified, and compensated direct care workforce. The other irony is that many of those providing direct care and support to Iowans don't have access to health care themselves, making it even more difficult to attract and keep good workers.
I was in the hospital for 3 weeks, and the bills just kept racking and racking and racking up. And while I was in the hospital with the staph infection, I found out that my insurance was cut off because they said I didn't pay a bill to keep it going. And I found out that they weren't going to pay anything on my hospital bills at all. And it got to be so expensive, and I didn't know what I was going to do.
It's not good when you've got people who are working in healthcare that don't have the benefits to provide healthcare to their own children. And we know of a number of cases in which direct care workers have children who are either on Hawkeye or Medicaid. And that doesn't say much for our society when that's the case. The people that we rely upon the most when our friends and family are most critically ill and require the most care, those people don't have the same access to care. That's just wrong.
It isn't a good thing that we don't have benefits and we don't pay well, but I think over time, as the labor force shrinks and we work more on skill development, I'm hoping that'll change.
Attracting and keeping direct care workers in the field not only affect our ability to serve the needs of Iowans, they also have far-reaching economic implications. Direct care workers tend to leave within the first 3 months of employment. The annual turnover rates are high. The cost of worker turnover is high and the pay is low. At least 25% of direct care workers have no health care coverage from any source, have minimal education standards, and few opportunities for advancement. The age of the workforce is increasing, and there's a high incidence of on-the-job injury and disability.
Having Wesley and friends and family helping me out is the other reason, but I don't want to go anywhere else. I mean, it's where I live.
Look at ways to enhance the profession, do some certification of direct care workers, build training. The mentoring program that the Iowa Caregivers Association, that is a great way to improve your retention of workforce. If they have that mentoring relationship with somebody else in the field, some colleague that they can share a great experience or a poor experience with, those are the types of things that we should be trying to support the professional association. We should be changing state policies so that we can improve recruitment and retention, those types of things that we could get involved with.
I think education is very important. More skill means more pay, means more recognition, means more reward. I think the better prepared you are, the more skills you have, the pay and compensation and benefits should follow that.
I've heard that the average cost of turnover per individual is about $3,500. Even if we lower that to $1,000 and you have a 70% turnover in a place of business, this is very expensive. This is even at $1,000 a person. If you turn over 10 people in a year, that's $10,000. And to bring new people in and continually have that happen is way too expensive. And if we have a government subsidized facility, and when I say that, I'm talking Medicaid, Medicare, then that reimbursement level needs to be realistic with the actual cost of care.
We need to understand that as a profession. We need to look at it as a profession that's important to keeping our folks healthy and well.
Those are the ones that should be the best trained and better paid. And the fact is that they're not. And we value them so highly to take care of the people that are closest to us, but when it comes to their benefits and to their pay and to their training, we treat them the worst.
Most agree that direct care workers are very important. Most also agree that their wages, lack of health care coverage, respect, and educational opportunities reflects a society that places a low value on direct care workers, what they do, and whom they serve.
Caring and caregiving are very undervalued in our society. It is hard. It's very hard to make a living in the world of caregiving. These issues are very serious and they demand our attention now.
The people who are touched value direct care workers immensely. But the problem is our culture doesn't value collectively direct care workers. And that really creates a very sad situation, a very far from just situation for care workers. We have to value what they do and reward them and acknowledge them accordingly.
We don't understand the type of work that direct care workers give until we personally experience it. And that's what we have to change. We have to change this perception that the only time we value direct care workers is when they touch our lives directly. Now we have to elevate their work, their worth, and understand that they hold the key to many of our elderly receiving the best care and living longer. And that's what we're committed to doing.
It's a very tough job. The problem that we have is that while it's a tough job, frankly, we don't treat it that way. We don't treat it as a job where folks always receive the kind of compensation they should have, or the training they should have, or frankly the respect that they should have within that profession.
The Caregivers Association is a leader at the state and national levels on direct care workforce issues. Through their advocacy, direct care worker leadership and mentor training, scholarships, conferences, coalition building, research, and expanded services through the Direct Care Worker Resource and Outreach Center, they have increased the visibility of this invisible workforce. The state's leadership, legislature, and congressional delegation understand that health and long-term care workforce issues are an important piece of health care access and reform. Together, we can ensure that Iowa continues to take steps toward building and sustaining the direct care workforce of the future.
I give a lot of credit to Di Finley and the Iowa Caregivers Association. Di is a passionate voice, and it's a voice that people are hearing across the street. And I think we're starting to see some policies, some movement towards support of this, of direct care workers that in the past we haven't necessarily seen.
I so believe in the kinds of work and the kinds of things that that organization is doing to advance the status of direct care workers.
We tend to respond to what we know. And as we hear more about what caregivers do, and we hear more about what this association is doing to get the word out, I mean, we all agree that we want better care for our parents and grandparents and all of our elderly. Whether it's my parents or the parents of someone watching this video, it's important that we provide quality care. We know that we're all heading in that direction. We're living longer. Hopefully we're living healthier. But when we get to that stage, we know what we expect and we want. So it's in our own self-interest to make sure that we have higher quality, better skilled, better rewarded persons that are providing that level of care when we most need it. Because when I push the call button, I have every expectation that whoever responds is going to be the person that can address my needs right then.
I'd like to challenge everyone to take a bit of time to explore this problem. It doesn't take a lot. It's in the news, but to get a handle on what we're facing in the next 5 or 10 or 20 years, and then invest a little of their energy appropriately, as they see appropriately, in solving the problem. If we'd all do something, we'd solve the problem. But it will take a lot of us doing something.
Mid-Iowa Health Foundation is exceptionally interested in applauding the work of Iowa Caregivers Association. We want the needs and the information to be shared with others, the challenges to be further understood, and for people to be prepared to respond to these needs by improving the benefits that are offered, to make sure that these individuals are encouraged to go into this work, to be trained to be ready to do the work that they're challenged with every day. It's important to our community. It's an access to care issue. It's an economic development issue. It is a very, very important need to have quality care, and direct care workers are a key to that whole area. Mid-Iowa Health Foundation would like to urge, through this video and through this increased understanding, like to urge others to become involved in this area by offering their time, their resources, their interest in understanding this important need.
If these issues are important to you, get informed, get involved by contributing your time, money, and expertise to the cause. For more information, call the Iowa Caregivers Association at 515-223-2805 or information at iowacaregivers.org, or visit the Iowa Caregivers Association website at www.iowacaregivers.org.